You see, the allograft bonerings is normally the same procedure like the autogenous bonering technique, but the allografts gives the benefit you don't need to harvest from the patient's mouth the bone rings. That means reduced surgical time, and also the morbidity rate is very lower, more comfortable for the patient with more or less the same clinical outcome. So the ring technique is actually a bone augmentation where you can provide the patient vertical bone augmentation. Usually we use this two-step procedure. That means first augmentation, later reopening and implant placement. With the bone ring, you are using the implant as a screw to keep the bone in the place, which is later on your fixture that provides to the prosthetic platform. The main indications we can just describe if you have a tooth in the frontal region of the maxilla or mandibular, single tooth or two gaps, and you have a bone loss. This is one indication. But as well, you have a high atrophic jaw in the mandible, in the lower jaw, free end situation. There is less space for the implant placement. So there is another indication. As well, you have a very sinus which has a very less bone height, so you cannot primarily fix the implant. This is another indication. So we can use the ring technique, including the sinus, in every vertical bone augmentation process. The most important thing is you have to understand the technique very well. It is a very sensitive technique when it comes to the wound closure and also to keep this wound closed, because all reopening problems related to the surgery will end up with a very big problem for the patient and for the dentist. My recommendation to all dentists, they should properly understand the indication, the incision, the wound closure, including the mobilization of the flap and the suturing technique very well. So for this we are providing a lot of courses, and you can get your proper education. But to start with such a technique without having experience in this field would be not recommended. In total, the ring technique is approximately 10 years since the first usage between my friend and Dr. Giesnagen and me. And we have experience during the 10 years above more than 1,000 bone rings, which in the last 5 years also very much growing the allograft bone rings. At the moment there are above 200 rings which is only placed in our both clinics.